Coloradans just want a shot. We did our part. We bent the curve last spring, held off the holiday surge. Putting COVID-19 behind us requires shots inside us, and the pace of vaccinations is crawling. You've told us families' frustration is turning to desperation. Eligible people can't get vaccinated, and the state's about to make it harder on them by opening shots up to more people. You've told us Coloradans are being left behind, stuck in a maze of online forms and jammed phone lines. Tonight, let's talk about it with the governor and his public health team. Colorado's vaccine rollout is going slowly because America's vaccine rollout is going slowly. Our state's vaccine distribution compared to other states is slightly above average, perhaps a source of soreness in a state that imagines itself to be slightly more than slightly above average. So let's talk about what's going well, what should be improved, and how we'll do it. Your questions, direct answers from the governor and his team on this Connecting Colorado Vaccine Facts Town Hall, available statewide and starting right now on 9 News.
Good evening, Colorado. I'm Kyle Clark. Welcome to our Connecting Colorado Vaccine Facts Town Hall, an hour-long commercial-free conversation featuring your questions for the folks in charge of this state's COVID-19 vaccine distribution. We're joined tonight by Democratic Governor Jared Polis, State Epidemiologist Dr. Rachel Herlihy, and Colorado's COVID-19 Incident Commander Scott Bookman. We thank all of them for taking the time to join us. 9 News viewers from across Colorado sent in questions to guide our discussion. We should say they have not been shared with the governor and his team ahead of time. If a question occurs to you while you're watching tonight, send it to me. Send a text to 303-871-1491. Please do include your name, where you're from, and your question, and we're going to get to some of those later in this hour. If you text the single word vaccine to that same number, 303-871-1491, we'll send you back a link to all the state's resources on finding a vaccine. Throughout the hour, we'll also show the state's vaccine question hotline phone number for those of you who prefer that. Chris Vanderveen, Director of Reporting at 9 News, our point person on COVID coverage, will also join me with some questions. So let's get started. Almost 500,000 Coloradans have been vaccinated so far. They are not the ones who sent us questions tonight. Nearly all of our questions focus on people who are waiting for the vaccine. Next Monday, Colorado opens vaccinations to people 65 to 69 years old, while at the same time, fewer than half of Coloradans 70 and older at higher risk have been vaccinated. Governor Polis, the first question for you. Dennis Regan from Parker speaks to the single most common thing we heard, that older Coloradans feel left behind.
Governor Polis, I have a question for you. Are you being real with the people of Colorado? If you were, you would take care of the seniors first and do the right thing.
Governor, your thoughts on Dennis's feeling that we heard from a lot of folks who feel that by moving on to the next stage, we're leaving the most vulnerable Coloradans behind.
So Colorado is among the states that is putting seniors first. We were, I think, the 4th or 5th state to begin vaccinating the general population. In our state, it was 70 and up. Some states did 75 and up from the get-go. Other states had a larger pool at 65 and up, which made it a lot harder and caused great delays for anybody to get the vaccine. But when we looked at the numbers, we looked at 70 and up, which are 78% of our deaths in our state, our people aged 70 and up. Just over 40% of our hospitalizations. And while we didn't know our exact numbers of vaccines at that time, we knew it was a group that we could get through likely in the 4 or 5 week time frame. We now expect that we'll pass a majority of people 70 and up in the coming days, and we feel confident expanding it to people 65 and up. We certainly are putting, just based on the data, those who are at greatest risk first.
We're going to spend a bit of time talking about that, Governor Polis. As you might imagine, a lot of the questions focused on the idea of vaccine access for folks who are 70 plus. I would also say most of the questions came addressed to the governor, who's free to defer to the expertise of his team whenever that's appropriate. Bridget Bothwell from Fort Collins is one of the Coloradans who's scrambling to help a neighbor find a vaccine. I want us to listen to what she has to say, and then another one of our neighbors has a specific question on this.
Hello, Governor Polis. I'm calling on behalf of my neighbor who will be 90 tomorrow. Why has she not got her vaccine yet? It is appalling, embarrassing, and totally unacceptable.
And Governor, you said today at a press conference vaccine providers may choose to prioritize higher risk older Coloradans when you open up the new wave of vaccinations to people next Monday. Nurse named Corrine Kreitzer wonders, Why not require that vaccine providers continue to prioritize people 70 plus while they open up eligibility?
While the governor acknowledges disparities exist, is he then not creating a disparity for those 70 and older by opening up further groups before this group has had the chance to get the vaccine? As such, should there be policy to deter creating such disparity?
Sure. So let me be clear about why on February 8th we're expanding the eligibility to people age 65 and up. It's because at that point, knowing what we know about the number of vaccines we have, we won't have enough people 70 and up left that want the vaccine to fill up using all of that vaccines in every part of the state. There are parts of our state, communities, that have already effectively inoculated everybody 70 and up in the community. Other communities are not quite there. It might take a few weeks to get there, but we need that flexibility to have a broader pool. Here's what would happen if we didn't do that. If we stayed with 70 and up till February 20th or the end of February, we would simply not be able to administer as many vaccines as we could by expanding that group. So there's a plus and a minus to everything. Expanding the group leads to more people who might be frustrated that it's another week or two, but not expanding it from a public health perspective means a slowing rate of immunization, because once you reach that 50-60% of people aged 70 and up, which we will reach right around February 8th, there are still people 70 and up that will want it and get it the week after that, the week after that, but there's not that flood of people that will allow us to fully deploy every vaccine the state receives within 3 days, which is our overarching guidance, so that we can end the pandemic as quickly as possible.
And I think, Governor, I think a lot of people understand that idea that you can't just like go looking for the last few 70 plus Coloradans while allowing vaccines to go to waste. But do you have it within your power and within the power of your health department to tell vaccine providers that if you have somebody who's 70 plus on your waiting list, you have to prioritize them over 65 to 69? Could you do that?
Look, I think that we will make it clear through, if we haven't already, and I'll make it clear, of course, we want to prioritize those who are most vulnerable. But what that generally means is appointments, and most providers will be for people 70 and up, yes, but then they won't have enough appointments of people 70 and up to fill up all their appointments, and so also 65 and up. There's some areas where they might still take another week working on 70 and up. There's other areas where they've completed their 70 and up. They're ready to move to 65 and up today, but frankly, we're saying you can't. We want to get that vaccine to other parts of our state where we haven't reached the full protection for 70 and up yet. Wait one more week before you open it up to 65 and up.
Surprise to you, Governor, to hear that there are Coloradans who are going to great lengths to try and help family members, friends, and neighbors who are so frustrated with the vaccine distribution process that they have basically given up at this point. Play this.
It started one night when I couldn't sleep and I found an appointment for one of my parents. I get their basic information that these online appointments are asking for. And then if I see something at a Safeway or King Soopers, sometimes Thornton Fire Department, then I can just enter in their information and tell them that they have an appointment.
That, Governor, is Sarah Gomez Marowitz, who's helped dozens of people get vaccine appointments because she basically spends hours scouring the internet for appointments and then enters these people's information for them. And the folks that she's helped have started calling her the vaccine whisperer. I think all of us probably agree that what Sarah is doing and what folks like her are doing is really wonderful. I mean, those folks are being great neighbors, but is that not a sign that the system is not working optimally if that's how people are getting appointments?
No, sadly, it's a sign of the basic math of the situation, where we receive about 90,000 vaccines a week. We can talk about some of the things we did to move second vaccines up, and then we get a few more back from CVS and Walgreens, but 90,000 a week, 588,000 people over the age of 70. So no matter how you break it to people, there's not enough for people to get it in the first week, the second week, even the third week. It simply takes 5 or 6 weeks till you can work through that group. And it's wonderful. And from our perspective, which is different than the perspective of any individual Coloradan, we want to make sure that every dose is used within 3 days to protect somebody that is 70 and up, that is chosen in a random or fair way that doesn't favor the well-connected and is somewhat randomized. The incentive for an individual is, of course, to get it for their loved one, their grandparent, their aunt, their uncle, themselves, if they're over 70, as quickly as possible. And so, yes, she was able to help people get it a week or two ahead of when they might have come up if they didn't know how to sign up on multiple lists. But everybody who's 70 and up will be able to get the vaccine by the end of February, by the simple number of vaccines that we are receiving. And we should have probably between 55 and 60% of people age 70 and up vaccinated by the end of next week.
You know, Governor, going through the questions that we received for tonight's town hall, I think that people have a pretty good grasp of how, like, the national supply chain for vaccines worked. You know, people aren't writing in upset with the state of Colorado in terms of the vaccine supply chain. They understand that's coming from manufacturers and through the federal government. And Colorado is solidly above average in terms of other states for the percentage of vaccines that we get distributed to us. Most of the questions and the concerns and the frustrations that we've received have been around the systems that Colorado and its vaccine providers have set up to connect people with appointments. So your background professionally is in technology and also in entrepreneurship. And this kind of seems like the kind of thing, Governor, where a single portal for every Coloradan to sign up, get ranked by priority, and then get given a vaccine assignment at some point would be hugely helpful. Is it too late now to do a single technical point of contact for people?
Yeah. So we, of course, looked at the pros and cons of different systems, and here's why that system would have been worse. A couple of reasons. One, and a lot of people don't know this, the vast majority of people over 70, we estimate about 80% of people over 70, and a similar percentage of people over 65, are actually already on a vaccination list without even having to sign up at all. And I bet many of your viewers who are over 70 who got the vaccine just got an email or a call and were able to do it. Why? Because they were simply registered patients at UC Health or Centura, Boulder Community Hospital, Vail Health, wherever they were. All of those folks are able to randomize their database, added in anybody who signed up, and simply began notifying via email and also via phone for people that didn't have email the opportunity to get vaccinated. So we didn't want to lose that. 80% of people age 70 and up already signed up. We didn't want to make everybody over 70 sign up. Now for that other 20%, yeah, we have to find them. And that means low tech, not high tech. My background's in IT. It's about websites, yes, but we actually had to push the other way to say you have to have our providers, that is UC Health, Kaiser, all those guys, phone numbers. You have to let people call in because not everybody over 70 is, or of any age, is able to successfully enter a form on the web and have confidence to do that. So they all have call-in numbers, English and Spanish, and all of those are randomized on a regular basis with their existing patient database of who they notify for the vaccine. We have a great system of private providers in our state. Hospitals, pharmacies, community health clinics. We wanted to take advantage of that, not reinvent the wheel, take advantage of that existing customer base to get the vaccine out quickly and use the technology they have and actually build back low tech with call-in phone numbers in English and Spanish.
Yeah, let's talk about those phone hotlines, and we're going to be putting the numbers on the screen for folks who want to jot them down. We'll put it up a couple of times during this hour if you don't have a pen or a pencil handy now. Governor, today you said that folks who are calling into the state's hotline are experiencing hold times of 20 to 25 minutes. Here's what happened when we called yesterday.
Your approximate wait time is
188
minutes. Your approximate wait time is
203
minutes.
It's certainly one thing when we're calling in as journalists to test the hold times. I imagine it's a different level of frustration for vaccine-eligible Coloradans who are calling to get their vaccine appointments. Folks like Joseph Manley from Centennial.
Governor Polis, my name is Joseph Manley. I'm 70 years old and I have a form of leukemia. This morning I tried to call for an appointment. I called 3 minutes after they opened and was informed I had 9 minutes to wait. After 12 minutes, I was informed I had 15 minutes to wait. After 29 minutes, I was informed I had 40 minutes to wait. And at 54 minutes, I had 71 minutes to wait. I hung up.
Now, Governor, I don't know if you want to defer to Scott Bookman, who's our COVID-19 incident commander for the state on this call center issue. Either one of you can speak to this. I know that you've expanded the call center capabilities. Give me a rough estimate of how long the average hold time is now, and then what's an acceptable hold time in your view?
So 200 minutes, 100 minutes, let me just say that's completely unacceptable. The average was 20 minutes. We would love to get it down to 10 minutes on average. I also want to make a point to people, if you're able to sign up online, please do sign up online and save those phone lines for somebody who's having trouble. Don't feel guilty if you can't sign up online. Please go ahead and call the number. But if you're able to sign up online, please do that to free up those phone lines. We are rapidly expanding the number of operators to get that average hold time back to 10 minutes or less, and I'd love to go to Scott on that as well.
Please, Mr. Bookman.
Thank you, Governor. Yeah, thank you. We are continuing to scale our call center as rapidly as we can. We know we need to answer people's questions, help them navigate the system in the best way possible. We are thrilled that so many Coloradans want to get this vaccine as rapidly as they do, and we are scaling to meet their needs every single day. I do want to remind people that the same phone numbers that are available through our hotline are also available on our webpage, and we'll take you directly to the providers.
Mr. Bookman, thank you. We report on the statistics daily of where we stand in the pandemic, and Colorado is in an undeniably positive spot in the COVID-19 pandemic compared to where we were a few months ago. So here are today's hospitalization numbers. 529 people hospitalized with COVID-19 in our state right now. We continue to fall down from November and December's peak hospitalizations. Monday's positivity rate was 5.8%. Our weekly average of tests coming back positive is just under 5%. That's good. That's the level that public health experts say that we should not be exceeding. And Colorado counted 684 new confirmed cases of COVID-19 yesterday. That's well under our weekly average, about 1,200 new cases a day. There's certainly plenty of reason for cautious optimism, though the variants of the virus that are popping up are a concern. Viewer named Lee Thomas wrote in asking us to discuss the impact of the variants. My colleague Chris Vanderveen has some questions on that.
Lee, it's a great subject, and let's get a little technical for a second and talk about something that really not just worries me, but a lot of people in public health right now. And it's going to be a word you're going to hear a lot more in the days, weeks, months to come, the term variant. I'm going to guess if you don't know it now, you soon will be. So first, let's put the whole thing into. Colorado has nearly 400,000 positive cases since the start of this back in March. 400,000, that's a lot. That's the green pie and the green part in this pie chart. There's a little white sliver up at the top. That's the total number of people the state has found with the variant strains. 16 in all, 13 of which are the variant that's tied to the UK. So yeah, small number. So what's the big deal? I actually want to turn to Dr. Rachel Hurley, the state epidemiologist, and want to start with the simple question. Why should we care about variants right now? We're getting a lot of attention in the news. Why, in your mind, should people start paying attention to this if they're not?
Yeah, so there's certainly a lot more for us to learn about these variants that are emerging across the globe right now. But, we have different concerns with different types of variants that are emerging. Specifically, we know that some of these variants may be more transmissible, meaning that they might spread more easily from person to person. We also know that there's the potential for some of these variants to cause decreased vaccine effectiveness, and that certainly would be a concern. And we know that there's also the potential for some of these variants to cause more severe illness. And so we are closely tracking them here in Colorado to make sure we can detect if they are occurring in the state, where they are occurring, and how many we are seeing.
A media call-in line that you were looking for you were testing about 200 to 300 a week right now of positive cases for those specific strains. Do you have a better idea? Your goal right now is about 5%. You're about 2 to 3% right now. Do you have any idea when you can hit that goal? Will you be at about 5% of the specimens that you're testing?
Yeah, our goal is to get to 5% really by March 1st. CDC's recommendation is 3%. We think we're pretty close to that right now with our capacity at our state laboratory. And so we really feel pretty confident that we should be able to get to that 5% mark and really exceed, the expectations that CDC has right now to really have a pretty good sense of where transmission is happening.
About a lot of this is that it really starts to remind people of what we were experiencing back in March. We weren't really testing a lot last year and wondering just how bad the virus was out there, only to be surprised when we start to find some cases out there. Are we sure that this level of surveillance right now, even if you do get to that 5%, is going to give us warning if and when things start to turn? Are we looking enough to see it if it starts to increase in large numbers?
We do feel confident in the ability to see emergence of this strain and sort of look, week over week at what changes in prevalence we might be seeing in the state occurring at that sort of testing level. But in addition to that, those efforts we have underway to randomly sample specimens that are being tested, we also are doing intensive case investigation and contact tracing. And so when we find these variant cases, we are looking upstream to see where they may have potentially come from, and then of course doing contact tracing to find where individual exposures could have occurred to prevent that sort of next generation of cases from occurring.
Public health Twitter is sort of buzzing with the idea of what does it all mean with the variant strains. I want to ask you a specific question. What do you think of the odds right now that a variant strain emerges that allows it to evade not just the antibodies in people who've had the virus, but the vaccine that nearly now 500,000 Coloradans have received? Should we be worried about that?
There is some data out of South Africa at this point, and some emerging data out of Brazil that does suggest that there could be a decrease in vaccine effectiveness. The impacts are small at this point, so there's really, I think, quite a bit more for us to learn. I do want to say, though, that I think Colorado in general at the state level is in a pretty favorable place right now, in that we are seeing cases go down, meaning that we are effectively controlling transmission in the state. And so those efforts that we have in place, all the things that we're doing right now, all the things that Coloradans are really doing to prevent transmission, so mask wearing, social distancing, all of those things will also help to slow introduction of variant strains in the state.
Thanks, Dr. Hurley. I think, Kyle, it's important to know that, as she was just talking about right there, we're in numbers that we haven't seen in this state really since mid-October. That's really good news considering where we were back in November and December. So at least we got that going for us right now.
Sure. Yep. Cautious optimism, phrase of the week. I want to get to some of the specific questions that viewers are sending to us during this town hall. Reminder, you're welcome to send me any question that occurs to you during the town hall. You can text it to me at 303-871-1491. Please just include your name, where you're from, if you would. If you text the word vaccine to that same number, we'll send you a link to the state's resources on finding a vaccine. And for folks who prefer to do business by phone, we'll be putting up the state's vaccine question hotline throughout the program tonight. I'll turn back to Colorado's COVID-19 Incident Commander Scott Bookman with a few what strike me, Mr. Bookman, as kind of technical questions that we might be able to dispense with. Diane from Arvada got in touch with us to ask whether we have a staffing problem in terms of getting the vaccine out, or whether we've got plenty of staffing and we're just waiting on supply. Diane in Arvada was curious whether we still have a need to bring out retired nurses and doctors and such.
Well, we do not have a staffing problem right now. Our biggest supply limitation is in vaccine, but we are welcoming all volunteers because we do anticipate our vaccine supply going up in the coming weeks and in the coming months, and we want to make sure that we are prepared to meet that demand, so people can sign up through our volunteer mobilizer so that they are ready to help us when needed. And as we do local community events, having volunteers who are familiar with those who are receiving the vaccine will help us have better vaccine uptake as well.
Mr. Bookman, Chuck Range wrote in with a question that we heard from a couple of people. He saw the mass vaccination clinic that UC Health put on at Coors Field over the weekend. 10,000 vaccines is a significant portion of Colorado's weekly supply, and Chuck was wondering whether those are taken and given to UC Health for the mass event from other providers. How does that work?
So each week when we go through our vaccine allocation, we are looking to make sure that we have the right spread of vaccine across the state, given where every other part of the state is. We're also working with our large healthcare providers to put events like this on across the state in the coming weeks. So the UC Health event that was at Coors Field last weekend, that vaccine supply basically came from the Denver metro area, since that is the population that they were going to serve.
And Mr. Bookman, one last question in this series of kind of technical questions. This is from on the Western Slope from Arlen in Ridgeway, who wrote into us. And Arlen had gotten the impression that they were at a lower priority due to the fact that they're small, don't have a hospital, only one medical facility with a doctor. We know that the state has designated some harder to reach communities as higher priority for getting the vaccine, but is there such a thing as a lower priority community, and is Ouray County that?
There is no such thing as a low priority county in Colorado. Like I said, each week we're looking at the data, seeing where each county, where each region is in their percent of vaccinations to completion of the phase that we're in, and then we move vaccine around to ensure that the whole state is moving across the phasing together. We also know that there are counties, there are communities where maybe there are access issues. We're working with our local public health, with our healthcare providers to really ensure that we're doing pop-up clinics, doing drive-through events to ensure that all have access to this vaccine in the best way possible for their community.
So that low tech that the governor specified in terms of reaching out and getting people's attention for the vaccine. Mr. Bookman, thank you. Governor Polis, back to you. You received the vaccine over the weekend. Which of the eligible categories did you fall under?
Critical government workers. We have about 200 people in the executive branch and I think many legislators have been inoculated as well.
Office said that your partner, First Gentleman Marlon Reese, also received the vaccine. Which of the eligible categories was he in?
Same one, First Gentleman of the state of Colorado, so in his official capacity. A lot of this came out of, and you've probably seen it, Kyle, and I got the vaccine, as I said, a couple months after it was available. A lot of governors went in the first few days, but I kept getting a lot of inquiries. And then, if you want me to get the vaccine, why don't you get it? If you believe in it so much, why don't you get it? And we do want people to get it. So it's important to put my arm where my mouth is, roll up my sleeve and get it. At some point, I can't ask you to get the vaccine if it's not something I'm willing to do myself. If you're eligible, if you're over 70, please sign up and get it. It'll make a big difference in your own life. 70% is great. We're going to hit that. We want to get 80 or 90% of people over 70 protected. Same with over 65, especially if you're in those most at-risk groups. Do it. I did it. I know a lot of people that did it. You know a lot of people that did it. It's no big deal, and I can now say that firsthand.
Will you commit to releasing the list of 200 people who are designated to get the vaccine at this point for continuity of government?
I don't think I personally have a list. I know who it was offered to, 200 people. I don't know how many people, chose to get the vaccine, and obviously that's private, whether they did or not. But, some members of the legislature say they did, others aren't answering it, but we can't release personal information. But it's 200 vaccines. That's not a large number out of the 500 and some thousand that we've put out there. And I think it is important for elected officials and leaders to say that this is all right to get, especially many of our representatives and state senators that are community leaders in communities of color. I was with some of them this last weekend, Senator Gonzalez, Representative Gonzalez Gutierrez, and Representative Herod. I mean, it really is a big deal when we have that moral authority where people can say, look, I got it, you can get it too. Because vaccine hesitancy is a real issue. It's a real issue already, especially in communities of color, but frankly, across our broader society. To end the pandemic, we know we are going to need to do better than our initial polling and research shows that we're at with regard to vaccine hesitancy. So anything that we can do to inspire confidence. If you're watching this and you've gotten vaccinated, tell your friends it was okay, it was fine. Encourage any friends that are hesitant to be able to get the vaccine as well.
And just to wrap up this point of discussion, Governor, you said that your partner received it through his official role with the state. On that list of 200, would we see other spouses or family members of elected officials?
Well, I saw like what the state of Kentucky did. They did it to every previous governor and their spouse. We have not offered it to previous governors and their spouses. Some obviously, and I sure hope, Dick and Dottie got it. I sure hope Roy and Bee got it. They're eligible by their age. I don't think Bill and Francis or John and Robin are eligible. Obviously, John's a senator, so he and Robin may very well have got it. But look, if Bill and Francis want to be able to be role models, we'll be happy to help establish that. I think it's important to establish confidence in the vaccine for community leaders. So, we'd be happy to do what other states did, like Kentucky. And if that's something, if there's folks that I can't speak to that, Francis and Bill Owen rolling up their sleeves can speak to in increasing confidence, we'd be happy to do that. And same with faith leaders in communities of color and others. It's really important to set this model an example. I mean, I can be a cheerleader, get the vaccine. How effective is that if I'm not myself taking the vaccine? It's just not as effective for the vaccine hesitant. Those who are going to get the vaccine are going to get it. That's great. That's not enough people. Those who are hardcore against it are never going to get it. It's really those folks that are kind of hesitant that we need to design the right kind of communication to speak to get them over the top to be willing to roll up their sleeves and get the life-saving vaccine.
I want to turn to some questions that we received from Coloradans who are still waiting for the vaccine. A lot of folks wrote in with very specific questions about their own health conditions or those of their family and when they're going to become vaccine eligible. And I hope that maybe by tackling some of these specific questions, we could at least give similarly situated Coloradans an idea of when they will be able to get vaccinated. So let's hear from some of the folks who are still waiting. Here's Skylar Hull from Broomfield.
Hi, my name is Skylar Hull. I am 29 years old. I have cerebral palsy, epilepsy, and I'm high risk for getting pneumonia. I was in the hospital in December for aspiration pneumonia. I am wondering how, when, and where can I get my COVID-19 vaccine? Thank you.
So Skylar there listed some of his medical conditions. I think a lot of Coloradans have gone online. They've looked at the chart that the state puts out, and it lists a bunch of high-risk medical conditions very specifically. If we could bring in the state epidemiologist, Dr. Rachel Herlihy, to discuss this. Dr. Herlihy, you heard Skylar mention some of his medical conditions, cerebral palsy, epilepsy, so forth. I didn't see those listed on the state's vaccine schedule as high-risk conditions. Is there a larger list beyond what we see, or are we to take the state's vaccine distribution schedule and say that somebody like Skylar is in the general population then?
Yes, I think it's important for Coloradans to know that we are really following CDC guidance and following the evidence base that exists for conditions where we see increased risk associated with COVID-19 infection. So conditions where we see increased risk of hospitalization, increased risk of death associated with those particular diseases. I do think it is important to also point out that there is language in those recommendations around individuals with disabilities, and so that is certainly an important group as well that should be prioritized for a vaccine, and certainly is in Colorado.
And certainly different groups in the medical space have different opinions on who should qualify where in the process. Know that the Global Down Syndrome Initiative refers to folks with Down syndrome as being at higher risk. That again is not a high risk condition that I saw on the state's vaccine schedule. Got a question, Dr. Herlihy, from Amanda Blankenship. Let's listen.
Hi, Governor. This is Amanda Blankenship. I have Down syndrome. I have a hole in my heart, and when I get the vaccine. So let's get this over with, and have a good night. Thank you.
Dr. Hurley, if you could speak to Down syndrome specifically, and then more broadly to folks who are immunocompromised or are on immunosuppressant drugs. How did the state decide where they're going to end up in the system?
Yeah, again, so I would point folks to CDC's website that has really great information and lists out the evidence base that exists for different conditions. And so really these conditions that we've prioritized here in Colorado are based on the evidence and the science that exists. And CDC has some nice websites where they talk through the different evidence that exists. They give references for various conditions and how they are prioritizing various conditions for vaccine prioritization.
Has Colorado prioritized our neighbors with Down syndrome?
I would need to turn to Scott Bookman for that question.
Certainly. I think we may just take us a second to pull Scott up, but we can do that. Because I think what happens is a lot of people look at the same chart that I looked at, and when they don't see a condition, they have future questions about it. Mr. Bookman, do you have any clarification for Amanda Blankenship on where Coloradans with Down syndrome are on the vaccine schedule?
Well, any disability that would prevent somebody from wearing a mask or social distancing is included in our prioritization, and so any further information can be found on our website.
How about folks who are immunocompromised or are on immunosuppressants? Do they receive any prioritization in Colorado's schedule, Mr. Bookman?
Again, we want to refer people to the website and really look into that specific to their condition, and then consult with their healthcare provider as well.
I would note for the record that I don't see any of those things listed on here, and I guess folks are just going to have to go to the website. Let's talk about occupational factors now in terms of when folks can get the vaccine. Sherry Swan is a hairstylist in Denver, got in touch with us, wondering about the rationale for some personal services workers who are in close contact with customers, where they fall on the vaccination schedule.
I was wondering if you all have given any consideration into moving the personal services industry into Group 1B.3 or phase 2. Our jobs do not allow us to social distance more than 6 feet apart. And then also a lot of our services require more than 15 minutes of personal contact. Could you give me your thoughts on this?
So we are not yet in phase 1B3, which is essential frontline workers, like grocery store workers and so forth, folks in transportation, faith leaders, that kind of thing. Mr. Bookman, was there a conversation around personal services workers? I know they were some of the first to get hit with COVID restrictions because the state came out and said, hey, listen, you're up close and personal with people's faces all day long. That's a real risk. Did they receive any prioritization?
Well, when we look at prioritization, we're really looking at two aspects here. First is, can these people work from home and do their job safely from home? And then two, how does it impact the overall functioning of our society? And so when we started looking at this, obviously prioritizing K through 12 educators was an easy choice. And then looking down into our public transport, our critical infrastructure, and really that is where we had to draw the initial lines in this as we continue to evaluate how to use this incredibly limited vaccine in the early days here.
Mr. Bookman, a question that just came into us via text. Want to read it. Lori Cadwell says restaurant workers have been at the front getting everybody their food for almost a year. They often work in close quarters, putting them additionally at risk. Restaurant workers, when will they get their turn?
So restaurant workers are included in food and agriculture. And again, so as we move into that part of the phasing, we will look at the ability to provide immunization to all members of food and ag at that point.
Additionally, when it comes to occupational factors, as we read it, the vaccine schedule gives priority to K through 12 teachers, priority that it does not give to college educators. Annabeth Hedrick, Associate Professor of Art History at University of Denver, was curious why.
Governor Polis, I'd like to know why professors are not considered teachers for Phase 1B vaccinations. We go into the classroom every day and risk our lives. Is it just because we volunteer to do this that we're not considered as important as K through 12 teachers?
Governor Polis, the professor has called on you.
Sure. Well, look, everybody will be able to get the vaccine. So this is just a question of when, and we have to define each group in a way that it's not too broad and not too narrow. If it's too narrow, that for instance, if we stuck to 70 and up through February and didn't expand to 65 and up, or if we had done 75 and up instead of 70 and up, too narrow means we failed to administer every vaccine that we received within 3 days. Too broad means so many people in a group that they could be waiting months to get the vaccine. And whatever frustration you're sensing now, Kyle, from people, some people 70 and up, about half of them who haven't gotten it, amplify that by 10 times if there was a really large group that was eligible. So we have to keep the supply roughly paired with the demand. And I think folks in Colorado who rely on our schools for their kids to be able to work know that that has got to be a priority to get them back. And it's not just about vaccines. We delivered tests to schools. I personally delivered it to 11. Amazon delivered it to most. We did a back to school task force. It's important for the kids' education first and foremost, of course, and we know that for many kids online doesn't work as well, but it's also critical for society, for a single parent in the workforce, for two parents who both work, for a kid who's 6 or 7 who can't be home alone. So the schools play this outsized function, even for college professors who have young kids themselves. They have difficulty working if the public schools aren't back. So everybody will get it, but not everybody can get it at once. So our very difficult job is to listen to everybody out there and try to keep it phased so that roughly supply and demand are aligned in a way where when it's opened up within a period of a few weeks, folks in that group will be able to successfully get vaccinated.
And briefly, Governor, we had a question just texted in by Kelly Hobbs in Lakewood. I heard you address this at your briefing earlier today, so I want to touch on this. Kelly works in in-home childcare and said that she believes that she's in the next phase that opens up as an educator, but she says that she owns her own company. She's curious how she gets in line for a vaccine as opposed to somebody who works for a school district who's going to be notified by their employer that they're eligible.
Yeah, at private schools, charter schools, school districts, child care facilities, All of those, it's about 120,000 people in the state. That's how we know that it'll take about 3 weeks to get everybody in that group, and why we're able to fit that group in and without slowing down the 70 and up and the 65 and up. So yes, it sounds like she would be eligible. She would be able to, likely she has some kind of health care insurance. I would start with seeing what her network is and talking to their provider about getting it. If they work with the school district, certainly talk to them. If they're with a network of providers, private schools are going through this as well. Obviously, if they're part of a network like parochial schools, they'll be able to do that en masse. But if they're an independent school, just figure it out with the provider. But they're eligible. The providers know they're eligible. You can set up a date to be able to go in during that 3-week period and get it done.
And one final question on this, Governor. Don't want to spend a ton of time on the general population because schlubs like me are at the end of the line. But for everybody who's looking ahead to a hot vaccine summer, we know that summer is the target for the final round of general population vaccines. Can you be any more specific than summer for general population?
Well, I have a specific ask for you now, Kyle, too. Whenever you are up, I want to ask if you'll commit to publicly getting the vaccine to encourage confidence
100%.
Among other members. Thank you.
Yes,
Thank you.
100%.
Yeah, and so the dates are hazy for all of us because of the quantity thing. We know what February looks like, Kyle, and we got the commitment from the Biden administration, 3 weeks. We know what we're getting. That's why we know we can move through the 70 and up, the 65 and up, the teachers. We know what February looks like. We do not even know what March looks like, no less April, May, or June. There's a lot of upside. Will Johnson & Johnson be approved? How many will we receive? It's 1 dose. Will AstraZeneca be approved? How many will we receive? It's 2 doses. Pfizer and Moderna, how fast are they ramping up? But we don't know any more than the public reports as to what the supply chain looks like. So our best guess, that's why we said early March, we think, moving on to those other groups of critical workers, 60 and up, pre-existing conditions. We don't yet have that sequence or the exact timing, but it'll be in March where we go to those different groups. And then, yes, probably May, June, somewhere in that time frame. It was what I expect for the general public, but it could easily be sooner or later, depending on the number of vaccines we receive.
Sure. Vial half full or vial half empty, I guess. All right, let's talk about the world once we start getting some more vaccines to Coloradans. I want to bring in my colleague Chris Vanderveen again for a discussion about what changes and what doesn't as Coloradans get vaccinated.
Kyle, I think anyone who's been paying attention knows it's been a long year. People miss their families. They miss hugging. They miss connecting with the people who have shaped their entire lives. And people who simply might not have much time left. Gretchen Samuels lives in Highlands Ranch. She really misses her husband.
Hi, Governor Polis. My name is Gretchen Samuels from Highlands Ranch. My question is, when will family members be allowed to go back into assisted living, memory care, nursing homes after the COVID vaccine has been fully administered to staff and residents in those homes? My husband is 59 years old. He has a rare form of dementia, and I have not been able to hug him or touch him since last March.
I'm working on a story on this exact same subject, so I'm very curious. I want to bring in Scott Bookman for an answer to this question. What can you tell folks who've just been waiting a very long time to see loved ones in these types of facilities? Once they get vaccinated, is the all clear sounded and they get to go in, or what's the deal?
Well, first of all, I just want to acknowledge that it has been an incredibly long year. And the difficulties that our families, our friends have gone through with this period of separation has been, in many cases, heartbreaking. And so, we are working with our federal long-term care facility pharmacy partners, CVS and Walgreens, along with our local public health and our healthcare providers to ensure that we get vaccines into arms within these facilities as quickly as possible. That program is moving forward as rapidly as it can now. Once those vaccines have been in for 2 weeks, we know that we start to see that high rate of efficacy. We are still waiting for some final guidance from the federal government on what regulations will be in place in those long-term care facilities as they are regulated at the federal level. But we do anticipate a loosening of restrictions, and as soon as that information is available, we're going to move forward rapidly on it so that people can get back to living their lives.
I know people are really impatient for an answer, but it's understandable. Can you give them a better idea as to when the feds are going to sort of lighten things up for these facilities and give people some sort of idea? Are we talking weeks, months, or days after they get the vaccine?
We haven't gotten any indication from the CDC or from CMS at this point on exactly what that timeline is. We're in those conversations. We understand the urgency here, and we don't take that lightly.
I want to go to a couple of questions from viewers with similar themes. First is from Linda. Could you please confirm a really important point that we've heard about COVID-19 transmission? We have heard while watching interviews of vaccine manufacturers that even if you've been vaccinated, you can still transmit the COVID-19 virus. So there's another big reason to continue mask wearing and social distancing. And then Gigi King from Paonia on the Western Slope asked, quote, after somebody has received the vaccine, they will not catch the virus, but are they still able to spread the virus? Since 2 vaccinations are required, could they carry the virus without becoming infected? I'm going to open this up to anybody who wants to answer it. I'm going to start with Dr. Herlihy. But do we have a better idea that once people are vaccinated, it seems like the prevailing thought is we believe they can't spread it, or we believe that potentially they could spread, but they can't get seriously sick. Is that still the guidance right now?
Yeah, so the clinical trials for these vaccines were really all based around prevention of symptomatic infections. But there is some preliminary data, specifically from the Moderna vaccine trials, that does suggest that individuals who had received just 1 dose of the vaccine were actually 2/3 less likely to have an asymptomatic infection than those that had received the placebo. So, from what we know about other viral vaccines, we do expect that this vaccine would prevent both symptomatic and asymptomatic infection, or sort of carriage of the virus. So we are really feeling hopeful that that is going to be the case, but like all things with COVID-19, we really still have more to learn, and the work is ongoing, the research is ongoing to really have a full understanding.
I think there's some really big long-term implications for the possible spread with somebody who's been vaccinated, but we don't yet know if they can spread, because we're talking about people wearing masks for a long period of time. Do we have any better idea if somebody who's been vaccinated or somebody has a lot of antibodies in the system because potentially they've been sick, can they still spread it, or we just simply don't know yet?
We think it's unlikely. As I said, there is some preliminary data from clinical trials that does suggest that individuals who are vaccinated are less likely to have this virus asymptomatically, just as they're much less likely to have it symptomatically. So we do think that there is probably protection. And, we've had lots of experience with lots of other viral vaccines, and from our experience with those viral vaccines, we do see that the vaccines do prevent carriage of viruses. And so we don't think that is a significant concern. But again, it's something that we really need to continue to study. And again, that's part of the reason that we really want individuals to continue to mask and social distance even after vaccination.
I've asked this question of a whole lot of people. I'm going to ask this of you. Do you believe that we should be wearing masks throughout the rest of this year? I've heard some people say yes. I've heard some people say no. I'd be curious your opinion. Do you think we're going to be wearing masks in December?
I think it's difficult to know precisely for how long. We certainly know that masks are a really effective strategy to prevent disease transmission. We know at this point, based on modeling data, that it's probably going to be at least several more months until we see vaccine at population levels where we see that herd immunity protection that's really so important. And so until that time, we really need to continue to rely on all of the other strategies that we've been using, so social distancing and mask wearing, to prevent disease transmission from occurring.
Kyle, I think it's an interesting proposition, this idea of when do we reach herd immunity, and then when do we reach the point where people can feel safe in a crowd. I think the difficulty is knowing when that time is going to be. Hopefully it's definitive, but I worry about a lot of that idea that maybe it's not as definitive as we'd like it to be.
It needs to be by the next Garth Brooks show at Mile High. I would just say that. Want to remind everyone, we will send you a link to the state's vaccine resources if you text the word vaccine to 303-871-1491. We're also going to continue showing the state's vaccine hotline number on the screen if you prefer to connect by phone. Be warned, our team just tried it a few minutes ago and the hold time was 118 minutes. Want to ask our COVID-19 incident commander, Scott Bookman, the next question. The state's reporting that 90% of Colorado's frontline health care workers have been vaccinated. Mr. Bookman, where does the refusal rate among frontline health care workers factor into that 90%?
Well, we're still gathering information from our healthcare partners right now. In preliminary surveys that our large healthcare systems did, amongst providers such as doctors or mid-level providers such as nurse practitioners, it was predicted that vaccine uptake in those groups would be over 90%. And then as you moved into other sectors of healthcare workers, it approached hesitancy rates similar to the general public of around 65 to 70%. So we're continuing to work with our healthcare providers to understand exactly what the hesitancy rates are and really working with them to get their rates up.
I guess I'm still foggy on what that 90% number means then if it's not 10% refused. Is it 90% of frontline healthcare workers in Colorado have been offered the vaccine and some percentage of them refused it? Can you help me understand where that number's coming from?
So at this point, that's 90% of all the healthcare workers that we identified using Bureau of Labor Statistics data about healthcare workers who fell into our category in 1A and in 1B. And of that estimate, 90% of them have been vaccinated. Again, we expect to see different rates amongst different parts of that workforce. Again, doctors indicating a much higher uptake than other parts of that population.
Okay, that did answer my question. I appreciate that. I might just be dense and I missed it the first time. Another question that I'm sure is very obvious to folks who work in this, but even as somebody who talks about it on TV every night, I'm not certain that I understand. When we talk about herd immunity, Mr. Bookman, what is the rough percentage we think that we need to get to? And when we're talking about that percentage of the population, are we including or excluding all the people who cannot be vaccinated due to either an immune issue or all of the young people who can't be vaccinated, because that's going to be a whole chunk of Colorado's population?
Well, first of all, these are all estimates right now. Our expert scientists are really trying to understand with this new illness exactly what number we need to reach to get to herd immunity. We hear numbers around 70% put out there, and so that is what we are targeting across the state to get to 70%. We do know that currently the vaccine is eligible for people 16 and up. There are trials happening right now for children 12 and up. So over the coming months, we do anticipate opening this up to a broader segment of our population, which will help us get closer to that 70%.
Thank you, Mr. Bookman. Governor Polis, you had said in the past that Colorado could triple or quadruple our vaccination rate if the supply from the federal government increased. I know that you were on a call with the Biden administration earlier today. Do you get any indication that beyond just kind of the general across the board increases, that there might be incentive increases offered to states that show an ability to scale up distribution, a reward of sorts?
We would welcome that. And for instance, we had UC Health ran at Coors Field, 10,000 over 2 days. If they had the vaccine, there's no reason that we wouldn't run that 7 days a week, right? And UC Health would love to, Coors Field, Rocky's organization would love to. We're going to be at the Western Shock Show with SCL, 5,000. We could do several times the amount. Relatively easy. We're ready to do it. That had been talked about on some calls. This was actually in the final days of the Trump administration. They talked about perhaps having an allocation, and we talked about it on a Biden transition call too, as an incentive for states that are successful in deploying it. We would welcome that. We would be thrilled. We would love some additional doses with our success in getting doses out. So it's not concrete yet. There's nothing that's been offered. It's being talked about. I think it would be a good policy for the federal government to do because it would align the incentive better for the states to get it out. So I'm hopeful, but I'm not as optimistic about that as I am about in general about the supply going up, especially with the hopefully pending approval of Johnson & Johnson, a third very compelling and powerful and effective tool that only requires one dose. So we're very excited about that.
Another quick question about the different states. Obviously, every state's different populations, different health infrastructure, things like that. As of yesterday, our neighbors in New Mexico were significantly outperforming us in terms of the vaccination rate. We were being outpaced by our neighbors in Wyoming as well. Do you get a sense for why? And has your team reached out to learn anything from them?
Well, I think we border 7 states and we're ahead of the other 5, but you had to list the 2 that we're behind. So, we're I think 11th overall. Every day we're trying to work hard to get out more. I'd say the biggest delay, and it's being somewhat rectified, has actually been the federal program, the CVS and Walgreens program. So the 3 or 4 states that are at the top, bypass that federal program, which we wish we did, clearly at this point. We shouldn't have relied on that. They were a lot slower than we would have been going into our nursing homes and senior care facilities. Thankfully, we are through that. We're getting doses back from CVS and Walgreens. They're going into this week and next week's total. But that is probably the single biggest factor. Other than that, we get every dose out within a few days that we receive in the state. But I would say that that program for the nursing homes and senior care facilities took about 3 weeks longer than it should have, unfortunately. And that was the case in 46 states.
And you're absolutely correct on your math. We are ahead of the other states, but I think Coloradans are used to beating Nebraska. Colorado's color dial, which had purple added on to signify the worst possible situation even before the Rockies gave away Nolan Arenado, that color dial is soon going to be updated. That'll have a significant impact on businesses and their restrictions. I want to go quickly to Chris Vanderveen to discuss that.
Actually, big changes are in store for the state's color-coded dial system. We talked about this color system for months. Saturday, the governor announced a plan to overhaul it in light of lower case numbers and increased vaccinations. I want to show you again what it looks like. Most of the state right now is in that orange range. There's a lot of implications that come with that, but basically the number you need to know is 25%. Most businesses can right now under orange can have 25% capacity inside. The state wants to make it easier to move from left to right, from let's say orange to yellow, which increases capacity from 25% to 50%. That's a big deal. So I want to find out where we are with this new plan. Governor, you had a public comment that closed yesterday. And today you said during your conference call that you were hoping to get more information from CDPHE this week. Do you have a better idea as to when this plan may be implemented, when people can expect that easing of the dial?
Yeah, so we got about 1,500 comments, and I think we expect to have it finalized by Friday and in place by the weekend. And, you know, it works both ways, Chris, as you've seen. Areas are because we're going down, moving out of yellow and red faster to less restrictions. But if the cases pick up, they also could get more restrictive faster to try to stop the spread earlier. Right now, we're on the downward trend. We welcome that. This leads to more opening in a safe way quicker. But it's really based on a lot of the learning from the last few months. Obviously, it'll likely be tweaked based on the comments we receive from the field all over the state, but people will be able to see the final product on Friday. And we do plan on updating it once more before it's abolished, which we all can't wait till that. But based on the increasing vaccination, as we protect the most vulnerable, 65 and up, people with pre-existing conditions, probably in that March-April timeframe, not quite ready to go away, but it absolutely can become less restrictive one more time.
All right. Our thanks to Colorado Governor Jared Polis, to our state epidemiologist, Dr. Rachel Herlihy, and our state's COVID-19 Incident Commander, Scott Bookman. Thank you all for taking your time to talk with Coloradans on this statewide town hall. And I think all Coloradans wish you the best of luck in the enormous task ahead. Final reminder, there's the state's phone hotline. There's the state's one-stop website, and you can text the word vaccine to 303-871-1491, and we'll send you that link directly. Thank you to everybody at home for making time for an hour-long important discussion. We know that the frustration out there is real, but there's a lot of folks working very hard to take care of their neighbors. So our thanks lastly tonight goes out to everybody in healthcare across this state who is pulling off something tremendous right now. We thank you and we wish you the best of luck. Good night.